And to finish up our combining form kerato, we're going to talk about keratoplasties, the corneal transplant. So surgical repair of the cornea. These are corneas that are provided by donors, who are usually younger people who've had an untimely death, meaning they died before we would normally expect them to, often result of car accidents and things like that. And so they've passed, they're an organ donor. One of the things that they may harvest from that cadaver are the cornea. And they do a surgical transplantation of a donor cornea into the eye of a recipient. And so without getting into the pathology of what happened to the cornea, that it needs to have a transplant, we'll cover that a little bit later. I just simply want you to be aware of the idea that keratoplasty is a form of cornea transplant and can help people who have pathologies of the cornea and can no longer see well. And now, I mentioned the iris earlier, and the iris is really important. Its combining form is irido. It's a round-colored contractile membrane behind the cornea. So a contractile membrane is another way of saying it's a sphincter muscle. Sphincter muscles are found throughout our body. They're the muscles that are round. I mentioned earlier peristaltic contractions. In the GI chapter, we talked about peristaltic contractions. Those are sphincter muscles. Here's another form of it. The iris surrounds the pupil. The pupil is simply an opening that allows light to come into the eye. And the iris will adjust the size of the pupil depending on the amount of light that's present. If it's very low light, the iris will come out will contract considerably, and it'll open the pupil up all the way to allow all available light in. And if you're in excessive amounts of light, it'll do the opposite. It'll close it down so that not too much light gets in that could damage the retina. Some of the words associated with the iris are iridoplasia, which is paralysis of the iris, paralysis of the sphincter muscle, in other words. Iridocele, which is a herniation of the iris, and this is a herniation that we're going through the cornea. And iridotomy, which is an incision of the iris. And we have an iridectomy. This is a special type of excision of the iris. It's not truly an excision as much as it is making an opening, but they do call it an excision for some reason, although they don't actually remove anything. So, with terminology always very, very precise, like I told you at the beginning of the semester. I think you've found out by now it's not. There is some wiggle room with these words. The rules that we talked about early on, very tight structure, don't always apply. Here's a great example of that. In an iridectomy, the excision of the iris, once again, which is kind of a misnomer, an opening is created in the iris. And what the idea is that it's allowing fluid to drain. The fluid is called aqueous humor, by the way, that we're trying to drain through this. And this is in order to relieve interocular pressure in patients who have glaucoma. So we're going to cover more details on glaucoma later. Let me just suffice it to say that the result of glaucoma as a pathology is it increases the interocular pressure of the eye, and in doing so can damage nerve endings and eventually destroy sight. The fluid in your eye needs to be able to move, and it has ports that are naturally there. If those ports are blocked or don't function any longer, an iridectomy is a way of replacing those surgically so that there is a port through which the fluids can move, and it reduces the interocular pressure and can help preserve the eye. And the pupil, which I've already mentioned already, the iris surrounds the pupil. The pupil itself is the opening in the center of the iris through which light enters. So it's essentially just a portal to the outside world, which is thankfully covered by the cornea, which protects anything from any transmission of materials through the eyeball itself. Two combining forms here. We have pupillo and choreo, both mean pupil. Pupillary is pertaining to the pupil, and a choriometer is a way to measure the size of the pupils, and that's very important in pathologies of the eye. In drug overdoses, it's very important because sometimes the eyes will be completely dilated in a drug overdose, or at least dilated enough that it's noticeable. In head trauma, if you ever see the pupil size different after someone's taken a blow to the head, that's an emergency room type of thing that you want to deal with. And a choriometer is something you would use to measure that pupil size initially, and then to monitor it for changes over time to see if the pathology is resolving. Aniso means unequal or dissimilar. Chorea means pupil. So we put it together, anisochorea, unequal pupil size. Maybe congenital, and so I just mentioned this a moment ago, and this is the actual word for it. So some people are born with it. If you're familiar with the musical artist David Bowie, who passed away a few years ago, he had two different color irises in his eyes, and that was not like a Marilyn Manson sort of, what do I want to say, colored contact lens thing. It wasn't something he did. It's the way he was born. He also had anisocoria. So he had one fully dilated pupil and one that looked normal. And in his case, and in people who have this as a congenital pathology, it simply is that. And it has some visual disturbance, but people live with it quite easily. The other type I mentioned earlier, drug overdose, severe blow to the head where you might suspect a concussion. So that's neurological injury or disease. So if you know someone who has just taken a medication, and maybe they've taken it prescribed by a doctor, that doesn't mean it can't have an adverse effect on them. Or they've taken a recreational drug, or they've taken a severe blow to the head, and you look them in the eye, and they look like this person with one dilated pupil and one normal-looking pupil, your first question should be, do you have anisocoria? Were you born with it? And you may want to say, do you naturally have one pupil larger than the other? And if their answer is no, as I stated earlier, that's probably a good time to head off to the emergency room. Of course, no panic involved. Just simply get them there, try to get them there calmly and sanely, because they could be suffering from a concussion, and it could be very, very important that they get immediate medical attention. So I don't want to overemphasize that because that's not always the case. But, if someone has anisocoria and you suspect something might be going on, the worst thing can happen at the ER is they say, look, this is no big deal, and send you home. Chances are, if this is not congenital, there is something going on and it does need medical attention. Finally, we get to glaucoma. I mentioned it already earlier. So this is a disease of the eye. It's a pathology that causes damage to the optic nerve. What happens is the fluid in the eye doesn't drain properly, as I mentioned earlier. It causes elevated interocular pressure, which we already talked about. It eventually leads to the loss of vision and can lead to blindness. And if you want to know a little bit more about it, in the upper right corner here, there's an illustration that talks a bit about glaucoma. And we all know from earlier that iridectomy is one surgical procedure that can happen to correct glaucoma. Now, people with early onset of glaucoma, if they catch it right away, surgery is not usually the first thing they do. Like we talked about in orthopedics. Usually there's other therapies involved, and surgery should be the last stop on the ride, not the first thing. Miotics are the first stop in treating glaucoma if it's caught early enough. They treat glaucoma, they cause the pupil to constrict, they allow fluid in the eye to drain, and they relieve interocular pressure. There are off-label uses, meaning uses that some doctors use miotics for that aren't intended for eyes. And the only cautionary tale I want to put out there about that practice is that miotics, in the case of this particular one they're illustrating here, pardon me, I just dropped something there. This is it's actually a form of kind of strong amphetamine. It's okay to put it on the eye because it's put in such a small amount. There are other uses where I've seen doctors have patients put a drop or two on the tongue to try to increase cardiac output. That's strictly off the books, should never be done. And just to be clear, ingesting this could be very, very dangerous. It could cause if too much got ingested, it could cause a cardiac condition that you don't want to go into. So miotics, by and large, are only used to treat glaucoma, should only be used to treat glaucoma. I'm just giving you that little tidbit of information because you may see it used in a different context, and maybe you'll remember me mentioning this at that time if you ever see it. When we're putting drops in eyes, medical assistants, nurses, maybe even doctors, definitely ophthalmologists, and maybe optometrists, the process of putting drops in the eyes is called instillation. And instillation simply means administration of a liquid drop by drop. Now, I did mention conjunctivitis earlier, and we're going to talk about it right now. Conjunctiva is a combining form for the conjunctiva, and the conjunctiva is a membrane that covers the whites of the eyes and lines the eyelids. So if you think back, when we talked about the respiratory system, we talked about a lining called the pleura that lined the outside of the lungs and the inside of the cavity, the thoracic cavity. It was all one continuous membrane and allowed movement of the lungs, and expansion and contraction without friction. The conjunctiva is very similar to that in the eye. So it covers the outside of the eye, the entire outside of the eye, and it also lines the inside of the cavity where the eye is located. Conjunctivitis is inflammation of the conjunctiva. Now, earlier we looked at sort of some trauma on the sclera when we saw scleritis. Here you're seeing true conjunctivitis, otherwise known as pink eye. It's typically caused by allergies, bacteria, irritation, foreign bodies. And one thing they don't really mention here is it's viral typically. And I find it interesting that they don't discuss that here. But it is often, conjunctivitis is often viral. There are antibiotics they'll use to treat it if it is bacterial, found to be. And they know this by the way it presents. And they can also do testing if they need to. What I've been told by most physicians is that conjunctivitis is simply the cold virus that's gotten on your eyes. And the classic way that this would happen is someone sneezes in their hands, then rubs their eyes. Especially in what we like to call COVID land, that's bad practice these days. Because we know the sneeze itself can be contagious and not a good thing. So you should never sneeze and then rub your eyes with your hands unless you washed your hands first. And it's best to keep your hands away from your eyes anyway. That's probably the most hygienic way to look at it. Anyway, that's conjunctivitis for you. Now, we're going to cover the eyelid. One of my favorite combining forms, blepharo. I just like the way it sounds. And we have a whole list of words that go along with blepharo. And I'll read these down for you so you can hear the pronunciations. Blepharitis is inflammation of the eyelid. Blepharoplegia is paralysis of an eyelid. It actually would be the paralysis of the muscles associated with an eyelid. Blepharotomy is incision of the eyelid. Blepharectomy is excision or all or part of the eyelid. Blepharospasm, you maybe have had these before, and they happen to me every once in a while where there'll be like a twitching in my eyelid. That's a blepharospasm, nothing to be concerned about. Blepharoptosis is a drooping of an upper eyelid, and blepharoplasty is a surgical repair of an eyelid. So you can see a before and after here of someone who's had blepharoptosis, and you see that in the left picture, and on the right you see the result of blepharoplasty. It's sometimes it's always a plastic surgery procedure. Don't let me mislead you there. It's sometimes voluntary. In other words, someone has this done for cosmetic reasons. Sometimes it's an absolute medical necessity because those eyelids have prolapsed to the point where they're actually affecting vision. So blepharoplasty can correct that. I knew a few patients who were in their elder years and had that done. And for them, it was a miracle because it helped clear up a vision disturbance that they had been dealing with for years. So plastic surgery versus medical necessity. Hordeolum, there's another great word for you. That's a small, purulent, inflammatory infection of a sebaceous gland in the eye, otherwise referred to as a stye. And that's a classic example of what they look like. They do get itchy and irritated, and the worst thing you can do is rub this area because it's just going to make it worse. Most physicians will treat it in various ways depending on what they think caused it. One non-medical, I'll leave it at that, non-medical way to fix this is to use warm compresses on the eye repeatedly over a number of days. So a nice clean aseptic towel with warm water on it, put over that area repeatedly, and it'll take several treatments, but eventually you'll get those pores to dilate again, to open, and then that liquid can drain out and the stye will resolve. Having said that, if you don't do any of that, it will resolve on its own. But it's always good to not let these go too far because you don't want them to get infected. They typically do not start as an infection, but they could convert into it. And when talking about tears in the eye or the structures that help produce tears or allow tears to drain out, the combining form is lacrimo. It means tear literally, and although we won't discuss it, in anatomy they'll talk about the lacrimal ducts, which allow tears to flow, and there's a whole structure around it. We're just going to give you this word so you're aware of it, and we're going to talk about lacrimal, which means pertaining to tears, and lacrimation, which is the secretion and the discharge of tears. So it's the actual function. We're down to 15 minutes. I'm going to pause it here. I'll be back with the next segment, and we're going to cover the rest of the eye, and then we're going to move on into learning some things about the ear.